Hey everyone, I'm really excited to have this conversation. This is somebody who's actually a member of our community, and he's been a member of our community for a while, and I got to connect with him over some really interesting conversations. And I thought if there's anybody out there who runs their own practice, wants to figure out how to increase revenue, increase and improve patient outcomes while using new technology and add it to what you're doing now without much of a heavy lift, I think you're going to enjoy this episode.
Welcome to the Passive Income MD podcast, where we talk about creating your ideal life through multiple streams of income. If you enjoy hearing about this stuff, make sure to hit subscribe. Now let's get on with the show.
So today I'll be talking to Dr. Tyler DeYoung. He's an internal medicine physician here in Southern California. He's also considered a healthcare leader committed to advancing patient care through both clinical practice and innovation, which we'll find out a lot about. He helps run the DeYoung Medical Group along with his father. He's also a medical advisor at a company called Dr. Kumo and a staff physician with Pro Health Partners. He's been primarily located here in Southern California, but through his advisory role, he's been really advancing kind of the knowledge about remote patient monitoring solutions that really empower physicians and then again, help patients in managing chronic conditions. We're going to talk about his journey. I'm so excited to hear about it. Tyler, how you doing?
I'm doing great, Peter. Thank you for having me.
Cool. Is there anything that you think I should be adding to this bio? I mean, again, you're such an accomplished guy, but hopefully I shared everything that I need to share. But let me know, is there anything on your background that I might have missed?
I think you covered pretty much everything. I do some nursing home and hospice care as well, but you hit all the high points.
One of the cool things that I mentioned right off the bat is that you're a medical advisor for this company called Dr. Kumo. And I'm sure we're going to talk about what that is, but like, what does it mean to be a medical advisor? Like, tell us kind of what your role looks like today.
That's a great question. You ask 5 different medical advisors, you're probably going to get 5 different answers. But to me, the boiled down version of it is a doctor who advises a company on the medical aspects that influence their business. So somebody who can give advice about the state of healthcare. It could be anything from how a drug works to how insurance authorizations work. I mean, it's very broad, but it can be as much or as refined as you want and as much or refined as the company needs.
Awesome. I mean, I know that when you came out of practice, you started as part of your private practice there. Now, when you're going through that and starting that process, did you ever think along that journey that somehow you'd be involved as a medical advisor to a nationwide global company? Is that something that was ever like part of your world?
That was never anywhere in my mind, Peter. When I was in residency, I really didn't know you could do anything other than the one job. So I went through medical school, figured out I need to be an internist. I went through residency thinking, do I want to specialize? I said, no, I like broad. I like to see a lot of different things. I finished residency and I chose between an employed position and private practice. And again, private practice offered me that breadth so that I could spread my wings and stretch out. And so coming out of residency, I started doing clinic, hospital, nursing home and hospice, kind of like those all just fell into place. And then as I just tried to be a good doctor to my patients, these opportunities came up. The most recent and the most interesting one probably is being a medical advisor to Dr. Kumo.
Yeah, cool. I mean, what were some of the challenges that you faced right away when you came out of private practice? Because I think these days, based on the numbers, most people are opting for more of the hospital systems and things like that in employed positions. But I will say there's been somewhat of a movement for more physicians to go out on their own, to have more control. And there are a lot of different practice models that allow for that. And we kind of really help encourage a lot of things or talk about those things in our community. But for you, when you came out and you were a private practice physician, what were some of the biggest challenges maybe that you faced, or maybe even some of the things you were surprised by?
Yeah, first of all, I'm really excited about that movement. I want more doctors my age and coming out of residency to go into private practice. I will plug that all day, all night. The challenges, I would say, and the big reason why a lot of doctors have chosen to go employed is that steady, reliable paycheck. So coming out of residency, they want to be guaranteed that regular pay, and they don't want to risk the chance of having high and low times. When I first started practice, I mean, most people who don't know about private practice may not realize that there's a 30 to 90 day lag between when you see a patient and when that money comes into your account. So I had to make alternative arrangements to kind of float for those 3 to 6 months before I really saw any kind of semi-steady income stream. So I'd say that's a big barrier that scares a lot of people. But if you can get past that, there's a lot of ways to manage it. It's absolutely so rewarding, and you should all consider it.
I mean, I know that you being part of the community, I know you've looked at all these other type of income streams. We talked about it. And, I know that within your practice, you found some really good options to optimize those things. And I think that's part of the story, which I think is really fascinating. So I'd love to hear what some of the solutions you had. Like you said, it's challenging in private practice to begin with, but let's talk about your journey into remote patient monitoring. I think that's fascinating. Like, how did you actually get into that?
So it came to me. I think I said before that I've always tried to be the best physician I can be to my patients, and the best owner I can be of my practice, take good care of my patients, take good care of my staff. That's kind of been my true north. And as I've done that, these opportunities have come to me, the director of a nursing home, associate director of a hospice, things like that. So the big one that came to me was this company came and wanted me to try remote patient monitoring out of my office. And I get a lot of people who come in and try to get me to prescribe their drug or use their DME and things like that. And I initially thought, this is just another one of those. But the CEO took me to lunch. She took the time to sit and have a meal with me. We had a real connection. She explained kind of what she was about, her values and mission goals, and what the company's trying to accomplish. And that really resonated with me. And so I opted to give it a chance. I was skeptical. I wasn't sure how well it was going to fit into our practice, but I said, okay, we'll give it a shot. As I did, all of my hesitancies melted away. One by one, they fell away. And I was just blown away by how much it actually did for my patients, how it improved their health, sometimes even before I changed a single medication, and how it improved my revenue. I mean, this was something that was literally a triple win for our practice. And I'm so glad I didn't say no at that time.
Yeah, I know a lot of physicians talk about they're always looking for ways to optimize their practice. I know a lot of people are turning to different patient care models. They're figuring out ways to either go around insurance, deal with all that. And I feel for them because it's really challenging in some ways, to run a sustainable practice these days. And so I'm actually curious about, the way it increased your revenue. Obviously for patient care, I'm going to ask you about some stories about that, how it improved maybe patient outcomes. But from the revenue side, like what do you mean it increased revenue? I don't understand how that works, but I would love for you to share.
Yeah. So there's several different models. I started with RPM, and now I do CCM, which is chronic care management, annual wellness visits. And these are all reimbursable activities through Medicare. And Medicare sets the bar. So if Medicare pays for it, then the other fee-for-service insurances, they'll pay for it. So the way RPM works is Medicare will reimburse for enrolling the patient in RPM, for collecting the data, if the patient's participating, for making phone calls to the patient and communicating with them, and for the doctor to review the data once a month. And each of these, it adds up. I mean, so if you think about it, most of those don't require my active input. So that's why I see it as a semi-passive income option, because the money's coming in. If I was a terrible doctor and I never looked at any of the readings, it would still generate revenue. Now, I'm not advocating for that. You don't want to do that. But if you follow it and you practice well, it's going to make you money and it's going to help your patients.
That's so interesting. So what kind of impact would you say, maybe you can give some sort of perspective on what kind of impact it's made on your practice, from either percentage or, some of the terms that we can understand of what kind of impact it's made. I'd love to hear.
Yeah. So I would say at this point, it's improved my revenue stream by 10 to 20%. It's allowed me to cut out some of the less desirable moonlighting options that I was doing, give away weekends, nights, and take some of my life back. So those are the ways that it's moved the needle for me.
I mean, that's the part of the story I love, right? Trying to figure out other ways without, leveraging your time, leveraging your skills and the resources you have to ultimately free up time for yourself to live the life you want. But also, you're doing better by patients. Hey everyone, healthcare is changing fast and physicians are being asked to do more with less. That's where Dr. Kumo comes in. With Dr. Kumo, you can bring remote patient monitoring into your practice, tracking blood pressure, glucose, heart rate, and more real time without extra staff burden. And the result? Earlier interventions, fewer hospital visits, better outcomes, and new revenue streams for your clinic. Plus, the Dr. Kumo Academy makes implementation simple. Your staff, caregivers, and even family members are trained on everything from device setup to HIPAA compliance so you can focus on patient care. Physicians nationwide are already seeing the benefits: healthier patients, stronger practices, and less stress. And it's easy to find out more about how it works. Just sign up for a free consultation at passiveincomemd.com/Dr. Kumo. That's passiveincomemd.com/DRKUMO. Hope you check it out. What if you could catch PIMD Con, the Physician Real Estate and Entrepreneurship Conference, without booking a flight? The PIMD Con 2025 virtual ticket lets you join live from anywhere. Grab your friends, your team, or colleagues and experience the event together from wherever you are. You'll earn CME, watch every featured session via live stream, and get lifetime access to the recording so you can rewatch anytime. You'll also get access to our vetted sponsors and partners online. So if you decide to act on an idea, you know exactly who can help you put it into practice. Now, after the conference, we're going to keep it going with PIMD Con Encore Nights, where I'll host small group breakouts, live speaker Q&As, and targeted networking, all done virtually. So bring your questions, get real-time feedback, and leave with a plan you feel good about. And here's the fun part. You don't have to experience it all alone. Now invite your friends, your team, or colleagues to join you online and save up to 50% with group ticket discounts. Now we've packed this year's agenda and I couldn't be more excited. So if travel's not in the cards for you, I get it, but I still want you there. The virtual ticket really is the next best thing to being in the room. So grab your virtual ticket at PIMDcon.com. That's PIMDCON.com. See you online. Now back to the show. How did, obviously this remote patient monitoring now allows obviously a lot of insight, a lot of data into what's going on day to day, beat to beat almost to some degree, right? But what's the true impact of that been for your patients? And maybe share a story about specifically how it's helped somebody.
Yeah. So if you think about, I'll use an example of a patient with congestive heart failure and hypertension. So I may see that patient 2 or 3 times a year based on scheduling availability, what the patient can handle, and what their needs are. In those 4 to 6 months in between a visit, a lot can happen, and often does happen pretty quickly if things are not being monitored. And that's when they end up in the emergency room. If they're in the emergency room, they're geriatric, they got congestive heart failure, there's a better than 50% chance they're going to end up admitted to the hospital. So this is a significantly costly patient to not only the patient, but also to the insurer. So they've recognized this and started advocating for this remote monitoring system, because in those 6 months between when I see the patient, I'm keeping track. I'm keeping an eye on their blood pressure. I'm watching that dry weight on the scale, and I can course correct. And it only takes me seconds to a minute to do that. Whereas if I let it go for 3 months and they decline, that's going to take 3 days to diurese that patient, get them out. And these are actual people. This has happened in actual people in my practice. So it's not just a hypothetical. I've also seen patients within 3 months of being on the program, their blood pressure went from 80% stage 2 hypertension to 80% normal to stage 1 or elevated hypertension. And that's before I even changed the dose on their medication, just because they are actively engaged. We're tracking and monitoring, and the staff at Dr. Kumo are reaching out to them and encouraging them to do things that are better for their health.
So, first of all, yeah, why is it called Dr. Kumo? I'm always just curious. That's a curious name. So,
Yeah, it's a good question. It's often one of the first questions I get. So I always tell people Dr. Kumo is a company, not a person. One of my patients will ask, "Who is Dr. Kumo? When is Dr. Kumo going to call me?" But so Kumo is Japanese for cloud. It's a technologically based company. So digital health, capturing of data in the cloud, and doctor just meaning someone who's an expert in their field, very learned. And so, yeah, an expert cloud-based company.
Cool. And not only did you end up utilizing this and helping your own practice and obviously helping patients, I think part of the story is really cool is that you wanted to become a medical advisor. And that's kind of a position that you are really spending a lot of time and energy on today. Like, what does it mean to be a medical advisor? And then I'd love to get into the story of how you became a medical advisor for that company.
Yeah. So broad strokes, a medical advisor is someone who advises a company on the medical aspects of their business. So that's at its most narrow level. You're telling them about how a drug works, how insurance authorization works, how the flow of a patient goes from hospital to nursing home to office, things like that. But it can be much broader too. It could be, I've gone on sales calls. I've met with clients. I've helped them revamp logos. That goes a little beyond the medical part of my advisor. But if you're advising the company and you have a close connection with them, you're really passionate about what they're doing, you want to help it succeed. And so that's more my business mind than my doctor mind. But yeah, it's as much or as little as you want to contribute, and as much or as little as they need you for.
Got it. I mean, what are the true benefits for you to do that? Because I'm just curious. We probably many people in our community have heard about being a medical advisor and trying to understand what some benefits are. And for you, like what are some of the benefits?
Mm-hmm. Well, some of the immediate benefits is I like to say it scratches a different part of my brain. So it activates it in a way that gets me excited, gets me curious, and makes me think about things in a fresh, new way. It is much lower stakes than we're used to as physicians. So nobody's life is on the line when I'm taking a board meeting, God willing. But and it it's very rewarding in that way. And then there's the potential for financial reward. So if you're part of a startup company, you can have stock options. And if that company succeeds, those stock options could become worth quite a bit down the line. So that's some of the benefits, aside from getting like a stipend and being paid for your advice.
I mean, having gone through this journey of going out and coming out of training, going through all that and becoming a medical advisor, like, what do you think the potential is for other doctors to go down this route if that's something that they've always wanted or interested in, right? They have that entrepreneurial itch. They have this way to contribute in another meaningful way beyond just clinically. What do you think the potential is for other doctors to be able to do this?
I actually think it's pretty high. There's a lot more of these opportunities out there than I ever thought were possible coming out of residency. I mean, I thought you finish residency, you have a job with these parameters, you stay in this box, and you make money doing it. But as I've gone through these 8 years post-residency in my career, I've had so many opportunities come to me and be offered to me or present themselves to me in a way that I knew I wanted to pursue it. So Dr. Kumo came to me and I was a client. Because I wanted to provide good care, I gave them feedback on things that were working, things that weren't. And because I offered that, they thought of me as somebody who was already giving them advice. So they came to me and said, when we get a little bit further down the line, we'd really like to bring you on board. And honestly, they ended up pulling the trigger sooner than either they or I thought they would, because we really wanted to work together and we came to some good terms to do that.
Awesome. I mean, now that you're in the middle of, I will say, a lot of the transition that's going on, even in medicine, the way we practice is a lot about integrating technology. We've been doing that, but even more so these days, I'm sure it's changing almost on a weekly, monthly basis about what's available to us in terms of technology and things that we can utilize to improve patient care. And it also, of course, improve our praxis. So where do you think this goes from here? I mean, do you think this only continues to grow? I'm talking about remote patient monitoring and the benefit it has for practices and people and patients. Or are there going to be some maybe obstacles ahead that maybe are going to be some challenges ahead?
I think we're on the precipice of explosive growth in the remote patient monitoring, digital health, technological space of medicine. I think that, and this is coming from a guy who loves every aspect of the physical exam and wants to lay hands on patients and see, feel, hear, and know things. The way that technology is advancing right now affords us the ability to do some of those things that we could only ever do in person before. And I was initially reluctant about that. I was skeptical, but as I've seen how it actually pans out, I just get more and more excited every day about where this is going, what's going to happen. And I'm really excited for the future.
Awesome. I know that some people are going to hear this. They're going to want to connect with you. They're going to connect to some part of the story, whether it's you being a medical advisor, whether it's even hearing about Dr. Kumo or whatever it might be. What's a great place for people to connect with you and maybe even connect with some of the opportunities that might be there?
Yeah. If you listen to this before the end of the month, we will be at PIMD Con. I'll be at the booth. Please come talk to me. I'd love to hear your story, talk more, and tell you more about Dr. Kumo. And if you want to find us online, we're at passiveincomemd.com/Dr. Kumo. That's DRKUMO. We really want to make this accessible to this community. This community has given so much to me. I love you guys, and you have so much to offer. So please, by all means, connect with us, reach out to me, and we'd love to talk.
Cool. It's an incredible story, again, of just showing what's possible when you try different opportunities, try new things, and who knows where it'll lead. And again, I'm excited to have you at PIMD Con, so that you can connect further with the community and just continue to share what you're sharing. Incredible work. Keep it up, and let's talk again soon.
Thanks, Peter.
Bye.
Enjoy the show? Let me know by dropping a review in the podcast app you're listening to us in. And if you haven't already, make sure to hit subscribe. Join thousands of physicians who are also on this journey to creating their ideal lives through multiple streams of income. Learn more at our website, passiveincomemd.com. Thanks again for allowing me to be a part of your journey. See you next time.